Hi guys, happy nursing, and today we are going to talk about hypertension, which is high blood pressure. And just so you guys know, before I get started, you can actually follow along with a written out version of all of these episodes. We have a free ebook for you. It's beautiful in color, and you can follow along with everything we're going to talk about here. So it is free. You can download at nclexbook.com. So NCLEX book, BOOK.com, and get that free download. So you can use that to follow along with any of these little mini episodes. So again, today we are talking about hypertension or high blood pressure. And the first thing that we are going to discuss is the assessment of hypertension. Now, you are definitely going to evaluate for any risk factors. And this is particularly important with hypertension because hypertension is actually known as the silent killer because it tends to be asymptomatic until a lot of actual end organ damage has occurred. So, it can be there, present, and happening for a long time without anybody knowing. So knowing those risk factors and evaluating that is actually a really important part of assessment. So some of the things that we may see down the road, some of the end organ damage that might occur, is leading to something like a stroke or an MI, a myocardial infarction. It can cause renal failure or heart failure. So when we're damaging these vessels over time, which the high blood pressure can do, it can cause the biggest problems, of course, is leading to the brain, stroke, leading to the heart, or leading to the kidneys, because that filtering that the kidneys do, those vessels are super, super important. Later signs that you may see is changes in vision, because it can damage those little vessels in the eyes. We may see frequent headaches, dizziness, or even some chest pain and angina. Okay, so again, assessment for hypertension, you're going to look at risk factors, realizing that this is a silent killer. It tends to be asymptomatic initially, but that we may see some later signs, vision changes, headaches, dizziness, chest pain. Okay, now let's talk about therapeutic management of hypertension. So we have some medication options, medication therapy. We may see ACE inhibitors. We may see beta blockers, calcium channel blockers, or diuretics. So all four of those may be an option for blood pressure. The second biggest piece of therapeutic management is diet and lifestyle modifications. So there's definitely some things that can be done from a diet standpoint that may help with this. The second piece of therapeutic management is, kind of what are your nursing priorities, right? So we're going to really prioritize perfusion. So we're going to administer those blood pressure meds. We're going to check blood pressure. We're going to check heart rate first. Next, we're going to assess for end organ damage, renal status. We're going to look at neurostatus. It's really important to have strict eyes and nose. So that's strict ins and outs. You want to really be tracking exactly how much fluid is going in, how much fluid is coming out, and to watch that and to evaluate. And lastly, assess for CV changes. Okay, so those are the biggest things with therapeutic management. Again, hypertension is high blood pressure, and so we love going over this stuff with you guys, and happy nursing. This has been another episode of NCLEX Flash Notes Podcast, your no-fluff study companion for NCLEX success, providing exceptionally clear and concise content to conquer the NCLEX exam. Now, if you want to follow along while you listen to this show, you can head over to nclexbook.com to get our free ebook, NCLEX Flash Notes, with 77 must-know NCLEX nursing topics. And as a bonus, you'll receive 16 full-color nursing cheat sheets. Don't wait. Visit nclexbook.com today. That's nclexbook, NCLEXBOOK.com. Happy nursing!